Well, I think we did a lot of education on PPE. We worked very, very hard educating all of our community members on it. It was a huge shift because in some of our programs, the families, especially for the ones that reside with us, it was a harder time for some of them because we couldn't allow visiting, because if they were living with us, we couldn't expose them to people outside. So we had to do the shift from getting the families trained to using the tele devices, FaceTiming, um, driving by, we would let the individuals come to the porch, those kind of things. That was a big shift. So we had to do a lot of training with helping the families to understand how this pandemic, impacts individuals. So I think, since we're almost 1 year in now, next month will be a year, and our cases, knock on wood, have been very minimal in comparison to other institutions or agencies that house individuals or that are still working because we're essential workers, so our staff still meet face to face. We're required. So our therapists, our doctors, our nurses are all meeting face to face. So we had to do a lot of work with training them on proper use of PPE, how not just wearing the mask, but how to wear it, hand sanitizing, make sure we had those hand sanitation stations throughout all of our buildings, keeping supplies, keeping cleaning there, being transparent when someone reported that they might have been exposed, notifying staff and families, training our families on how we were what our communication method would be for those type things, taking the precaution and closing for a day or two to make sure we did thorough cleaning if there was a positive case before we brought other individuals back. Just really working also with our county, Clayton County, has been a great resource. I serve also, I'm one of the board members for the Board of Health here in the county. So that's been a great area too, because through that collaboration, we've had a lot of good training coming from Dr. Reddy, our Clayton County medical director, and also from Chief Murkison's office, Clayton Emergency Management. We've all worked together to come up with, great ways to triage when we had people that might have been exposed. I mean, they were Johnny on the spot, helping us, because now we're a rapid testing site for our staff and individuals. We've been trained to do it for our staff those in our care. We can do the testing for them. But prior to, the county was doing that for us, and they were just right on it, getting the individuals right in and out, getting the results back quickly. Dr. Reddy was ready to go to talk to the groups, sharing information. Our medical director here at the center has been very involved. So taking that, I put a lot of money. We were able to get some of the CARES money. So we put a lot of money into the cleaning, purchasing masks. We got organizational masks, customized masks. So all the staff have several of those. We also keep an abundance of the ones disposable ones, if that they don't have one, or somebody missing coming to work without their mask, or individuals show up for treatment. We don't advertise that we have masks, but because the people will just come and won't have them. But if somebody present, we do have them in the event to make sure they can get their services. I'm a man of faith. So a lot of when this pandemic first started, a lot of others were closing down services and were not meeting there with their individuals. We walked by faith and we served as much as we could to the extent of the law. And with also, I've learned, I guess, from my career, I've been in leadership for 30 years. So I've learned is strength in numbers and in wise counsel. So I take the advice of my staff as well as my own, before I make decisions. So asking them how they felt about things, not asking people to put themselves in harm's way, and utilizing those people that were most comfortable in those areas. And a lot of times when you allow people it to be their decision, it goes over better. So with the moving in the level of comfort with the staff, I think was really probably the greatest thing that I've learned along the way of allowing the staff, because they're the ones that do the work day to day. They're the boots on the ground. And when you value them and value their opinion, and having meetings with them and being transparent, to me, that was valuable. And as I was stating earlier, learning from our sister organizations, many of them just shut down immediately. You know, everybody's like COVID. And now some of their programs are really suffering because they can't get the momentum back up. The staff have gone on other places to work. And, you know, most of our staff live in Clayton County, which is beautiful. We have about, right now, about 150 staff members that work in all of our various programs, and most of them are Clayton County residents. So they have I think they have a higher stake in what happens here in Clayton, because this is also their home, and they want to. And I can't speak highly enough for. I mean, I'm gonna just be honest. Coming into this mental health, when I first came over here, I've been in leadership, but coming into mental health, I've worked. You know, I've teach psychology and those kind of things. But shifting into this role and dealing with the substance and the hands-on therapeutic models, I'm telling you, these are the most compassionate, caring staff I have ever worked with. I was an educator, and I thought my teachers were the bomb. But over here, I'm telling you, I have to stop them sometimes, remind them these are not your children. The individuals that are, some of them are older, that suffer with the developmental disabilities. I mean, the staff go over and beyond to care for them, and they really treat them like they're their family. So when you have a staff like that, it just makes your job so much easier.